Hello and welcome to today's video. My name's Travis Tarrant and today we're going to be talking about cervical stenosis. Let's get into the video. So let's get straight onto it. What is cervical stenosis? Well, cervical stenosis is the degeneration of the cervical spine over time which causes compression. This can be, for example, as a result of excessive wear and tear. Now in my hand here, I've got an anatomical version of the spine itself. And the nice thing about this is it's actually color-coded for us. So it makes it easy to distinguish the cervical spine, which is in purple, and where it starts and where it ends. And one of the most common questions I'll get is somebody will have gone for an X-ray and they'll get the results back and it will say, they'll say, Travis, my C2 and my L5 and my T3, and I don't know what this means and help me out. So C refers to cervical, T refers to thoracic, and L refers to lumbar. So thoracic blue, lumbar green, and cervical in the purple. And the numbers, we work from top to bottom. So let's say if it was C3, it would be cervical vertebrae 1, 2, and then 3. And what makes it nice on a model like this is you can actually see the affected area if you know that you've got a certain affected area within your spine. Now, what we want to talk about today is that compression. So within the base of the brain, we've got right at the base of the brain a bundle of nerves, and this is called the spinal cord, and it goes all the way through these vertebrae. And they sit, these bundle of nerves, in what's called the spinal canal. And the difference between someone with cervical stenosis and somebody with a healthy normal spine is with somebody with a healthy normal spine, this spinal canal has got ample room for these nerves in the spinal cord. Somebody with spinal stenosis, however, due to the degeneration, has less room. Therefore, all of a sudden, the room that used to look like that is now getting compressed and it's causing all this referred pain. Before you get onto your stretches and exercises, it's really important that we actually try to mobilize the neck as much as possible. And one of the techniques that I would use to do this before you even start any stretches and exercises is to use wet heat. So for example, using a towel or a flannel, popping it around your neck so it covers the frontal, the lateral and the back of your neck. And what it will do is that wet heat is going to help to penetrate, soften and get circulation within the neck. So for example, if you didn't use that wet heat and you got to here on a side bend, maybe with that wet heat and using that for 5 or 10 minutes before you do that movement, you might be able to get that a little bit more or that little bit more of a stretch. The other thing I want to talk about is P&F stretching. When we talk about P&F stretching, all it means is if I was going to turn my head to the side and do a P&F stretch, and this is as far as I could go, otherwise, it starts to hurt. What I'm going to do is I'm going to put my hand on the side of my head. I'm then going to push into my hand for 10 seconds, around about 70% of what I can. Don't go full throttle. And when I push, I'm pushing into my hand, so my head's not going anywhere. All of the muscles in the front part of my neck now are starting to contract. And then all of a sudden, when I let go and I stop, I'll be able to go a little bit more. So a P&F stretch is working through contraction, but without the movement. Because what we don't want to do is get to here, you can't go anymore, and then you're forcing to try and get that little bit more range of motion. By tricking the body into contracting the neck muscles, big deep breath, and then releasing, you should be able to get a little bit more without that pain and strain associated. So let's get onto those stretches and exercises that we can do to help range of motion in spinal cervical stenosis. So let's start to mobilize the neck. Our first exercise is a side-to-side head tilt. To begin, place your hands underneath your glutes so your shoulders stay down during the exercise. Then start to tilt your head towards your shoulder. Try to think of this as you're bringing your ear as close to your shoulder as possible. You're going to do this for 10 repetitions on each side, nice and gently. Be aware of your range of motion and don't push through any pain. Stop just before any discomfort if you do get any. Do this for a total of 2 sets.
Flowing directly into technique number 2, which is an upper trapezius stretch, place your hand on the opposite side of your head and begin to pull your head towards your shoulder. Your free hand should still be underneath your glutes to help pin down your shoulder. We don't want your shoulder to start elevating up during the stretch. The upper trapezius is prone to getting tight during periods of poor posture, whether that's habitual or during sleep. And one important role that the upper trapezius plays is extending and rotating the head. So you can see how this plays a big, important role in increasing range of movement. Hold this stretch for 2 sets of 30 seconds. Let's get into our first P&F stretch, as alluded to earlier. Tilt your head as far as you can without discomfort, and then place your palm on the side of your face, your shoulders closest to. Begin to push against your hand. You should start to feel the muscles contract in your neck as you do this. As you push, make sure that your hand isn't actually moving as you push into it. After 10 seconds of pushing, stop, then try to get a little bit more range of movement in the stretch. The sudden contraction and relaxation of the muscles often tricks the body into allowing the body to go into a deeper stretch than we first thought was possible. Do this 2 times over on each side. Next up is neck rotations. Again, hands underneath your glutes to start, then slowly start to turn your head from side to side. Be careful not to push into any pain or tightness. Only work within a range that is comfortable and suitable for you. If you have no pain, you can hold the stretch for a second or 2 before returning back to center, like I am in the video. There are lots of different muscles in the neck that help to rotate the head, and these muscles directly attach to the cervical spine. For example, the levator scapular muscle. Getting these mobilized and looser over time can go a long way to helping relieve some of the muscular pain that cervical stenosis can cause. Do 10 rotations on each side for 2 sets. Now we're going to turn that head rotation into a P&F stretch. Rotate your head until you reach the limit of your range of motion before pain. Then, place your hand on the side of your face. Begin to push into your hand, and as you do this, you might start to feel that the muscles in the front of your neck start to contract. Imagine you're trying to complete that rotational movement previously, however this time your hand's a barrier that you're trying to push past. Once 10 seconds is up, breathe deeply and relax before seeing if you've improved your range of motion. Just like your previous P&F, repeat this twice on each side. Your next stretch is for the levator scapula. To start, sit or stand with upright posture and place your hand on the furthest corner at the back of your head. So for example, if I was using my right hand, I would place it at the back left side of my head. Imagine you're trying to pull your head down to your opposite knee and hold this stretch for 30 seconds, twice over on each side. The levator scapular muscle is often really tight in those with forward head posture and those who experience high levels of stress and in turn hold their shoulders higher than usual due to tension. Your next exercise is chin tucks. With cervical stenosis, there's already a degree of compression in the cervical spine. So to ease this compression, we need to develop and strengthen the frontal neck muscles. And this is going to help create better support for those cervical vertebrae. To start, lie flat on the floor with your head in a neutral position. Begin to draw your chin to your chest without lifting your head off the floor in the process. Hold and squeeze this position before returning back to your start position. Repeat this in total for 15 repetitions, 2 sets over. The human head weighs around 12 pounds on average. With each extra degree of forward head posture, the cervical spine has to support more added weight. This increases muscular tension. Getting these frontal neck muscles strong enough to support the head in a posturally correct position is vital to ease pain and dysfunction. If you're looking for something more challenging and abrasive, you can try these advanced chin tucks. The main difference here is I'm lying on a bench with my head hanging slightly. This is harder because I'm increasing the range of motion of the exercise. Repeat all the same teaching points as previous and keep the tempo slow. If you've never worked the frontal neck muscles, especially under this much tension, don't be surprised if they really start to ache the next day or 2 after doing this exercise. Do this exercise for 15 repetitions, 2 sets over. We move finally on to our last exercise, which is a chin tuck hold. I want to draw your attention to the amount of space in between my neck and the floor. This is important because I'm going to try and decrease this amount of space as much as possible. I take both my hands behind my head and tuck my chin into my chest. This new position allows for a nice stretch in the posterior neck muscles, the ligaments of the spine, and also the cervical vertebrae. Hold this position for 2 sets, 30 seconds on each set. I'll often get asked, how many times a week should I do this type of program? And to start off with, doing it twice or 3 times a week is perfect. However, try to get up to the stage where you're doing it at least every other day for significant change.
That concludes the end of today's video. Thank you very much for watching, and if you have any questions whatsoever, please leave them in the comments section. If you've enjoyed the video or you've learned something new, please leave a like and consider subscribing. My name's Travis Tarrant and you've been watching UK Fitness Hub.